So, the first thing to consider when you're conducting an intake assessment is, of course, informed consent, right? I usually start off the conversation by asking clients, have you ever been through this process before? Trying to keep in mind what it's like to be on the other side of the desk and get into the mindset of the person that you are speaking to. Because if it's somebody who has a lot of treatment history in the mental health system, they're probably very familiar with the intake process, the type of questions, the rigmarole. Um, but if they've never been through the intake process, it could be pretty scary. They don't know what to expect. So it's always good to start off by just letting them know that of course, everything is confidential and private, won't be shared with anyone else without their informed consent, explicit consent, unless, of course, it falls under mandated reporting laws, right? And so it's important to just keep in mind that it's well worth your time to educate the person on the other side of the desk, or the other side of the phone, or the other side of the camera, depending on what your modality is, telehealth, face to face, and help demystify it for them. So I usually say something along the lines of, the intake assessment is just a process in which we're gathering history in order to get a bird's eye view so that we can figure out how to best help you and also put together a plan to see how we can be of service in meeting your goals. And just let them know that there's nothing behind the curtain. This is mostly a history gathering process, but also as a clinician, we're looking for points of intervention for future implications in terms of how we can intervene, what their target behaviors are, compensatory behaviors, as well as any other clinical relevant information such as grief, loss, strengths, weaknesses, environment.